So today I wanted to talk about upper body pain. I've run into a lot of folks at Bloomington Mask Drive who frequently have aches and pains everywhere, kind of starting in their hands, fingers, thumbs, wrist, sometimes in the elbow, shoulder, neck, and even headaches. Okay, so all of these things are really common among folks who have hobbies and jobs that require them to use their hands and arms quite a bit. And the vast majority of them fall in some way, shape, or form under the category repetitive stress injury. So things that cause repetitive stress injuries are things like sewing, okay? Sewing those masks could cause repetitive stress injuries. Typing on your keyboards, if you are a desk warrior like I am part-time here at physical therapy, typing can absolutely cause a repetitive stress injury. Just the mousing itself, even if you don't end up doing a lot of keyboarding, because that's usually done with your dominant hand, that can result in a repetitive stress injury. Writing, whether again it's on a keyboard or handwriting things, gardening, all of these things involve holding your hand in specific positions for long periods of time. And the reason that that can sometimes cause injuries is because it involves holding a joint or a group of joints in a specific position for a really long period of time, or at least a longer period of time than may be really good for that joint. And then over time, your body kind of adapts to whatever positions you are assuming on a really regular basis. So when it comes to your hands, your shoulders, your neck, they have a tendency to be the areas where repetitive stress injuries turn up, because a lot of repetitive stress injuries are a result of things like nerves and muscles and connective tissue getting stuck in a particular place at a particular time, okay? And to illustrate kind of how that happens, I got a couple of props out today. So the first one is my bundle of Therabands, okay? So these Therabands are kind of like a muscle and kind of like the different structures in your body, in that a lot of things, especially in your wrist and hand, kind of flow in this fashion, okay? With a whole bunch of tube-like things running right next to each other, okay? So if you look at this bundle of Therabands, each one of these is color-coded for a different level of tension. And the structures in your body are not dissimilar from that, okay? So if you imagine that the red one is an artery and the blue one is a vein, the yellow one is a nerve, and the blue and green, and the green and black ones are muscles, all of those things might have different levels of tension, okay? So when you pull on something, the way that you do whenever you are moving this sophisticated lever system of levers and pulleys that is the human body, those things are having different amounts of tension on them, okay? So the human body is put together in a really amazing way so that all of these things can get where they're supposed to go. And so say this yellow nerve is connecting this part of your spinal column out all the way to the tip of your finger. It's got a lot of different structures to flow through, okay? And the fact that these are just kind of looking really tangled up is actually a fairly good illustration of how all of those things work together when you're inside the human body, because they're all there no matter what, and they're under different levels of tension. So if the way that you are moving is putting a particular muscle under more strain than it's used to because you're constantly assuming the same position, eventually that muscle or the joint or some aspect of that structure is going to find a way to adapt to that stress that is being put on over and over and over again. And whenever things are put under stress in the human body, a lot of times inflammation develops, okay? So inflammation is really just your body's immune system response. There's a whole lot of specialized cells. You may have heard of white blood cells. They are among those cells. Travel to a site where there is injury or inflammation and start trying to clean things up and fix things. And inflammation can kind of cause things to get sticky inside the human body. So whereas, you know, these muscles may like flow through their sheaths pretty easily at one point in your life so that they just move back and forth, at a different point, they may be kind of stuck or pinched like all together like this. A lot of times, especially when you're going through a passage where there isn't a whole lot of space, okay? So the human wrist is absolutely a marvel of space management, okay? There are something like 16 different muscles that start somewhere in the vicinity of the elbow and end somewhere in the vicinity of the hand. And they are all together layer over layer over layer. And so a lot of times, because we're all built a little different, everybody's bones are slightly different shapes, everybody's muscles are slightly different levels of strength. Sometimes they're totally different sizes. Sometimes you have a different distribution of one type of muscle fiber versus another. So everybody is really different. And it can get really confusing to try to figure out exactly what you are supposed to do in order to fix a specific injury. So with all of these layers in your hands that have to then pass through the wrist, through the forearm, and get back up into your neck and spinal column in order to feed that brain the information that they bring in, there are just a lot of different places where things can get hung up, okay? But one thing that you can almost always do in order to manage pain in this sophisticated system of levers and pulleys that is the musculoskeletal system is try to put it back where it once was, okay? So what I want to talk about now is it's called posture reversal a lot of the time in physical therapy world. And the reason, and some folks do not really believe in the research behind posture reversal. There are folks who will say when they see a patient who has their head way far forward like this and they have some bony changes and things like that, that you're not going to undo 30 or 40 or 50 years worth of damage with just a few sessions of physical therapy, or with just a few sessions of soft tissue treatments like Graston or massage. And while that's true, though there may have been a long period of time and a lot of life lived since a structure in a person's body started to change, there maybe has not been nearly as much time that has passed since that person started to experience pain as a result of that change in their musculoskeletal structure. So what I really try to focus on is getting the person back to at least the point before they had pain, okay? So a lot of times that involves identifying lifestyle factors, okay? Like the position that a person is sitting in when they're using a keyboard or sitting at a sewing machine, and making sure that they are not putting any more strain than necessary on all the many joints that come together in order to make that hobby possible for them or occupation possible for them. So that's where posture reversal comes in, all right? So for example, if you spend a lot of time at a sewing machine gripping things, okay, or out in your garden gripping stuff, or sitting at a keyboard with your fingers bent just so, it is really common to end up developing a pain somewhere in your wrist or somewhere in your hand, okay? So sometimes folks will have a condition called trigger finger, where there'll actually be some movement restriction in their hand. Sometimes it'll just be what folks call carpal tunnel syndrome, where you usually have a pain somewhere in this region of your wrist, or sometimes it's more on the inside here. So you go to your doctor, you have carpal tunnel syndrome or something like that, a repetitive stress injury, and you want to know what to do about it. And unfortunately, a lot of times you'll get the answer that you can just take some anti-inflammatories, ice it, put some heat on it, rest it, and it will stop hurting. And the thing that is really kind of tricky about that advice is that it works a lot of the time, okay? But it doesn't necessarily work as quickly as trying to reverse some of the original causes of that pain, okay? So if your wrist hurts because you are spending huge amounts of time with your wrist bent into like this position at a keyboard, because you're hunched over it, or because you are spending a lot of time with your wrist in this position because you don't have an appropriate keyboard rest, that is something that you can just try to mitigate in your day-to-day life, okay? So that's kind of step one. Try to get to the root cause of whatever is causing that pain. Maybe you are sitting at your desk or your sewing machine or whatever with your head way forward like this all the time. Or maybe you have a tendency to have whatever you're working on way too far out in front of you, and so you're always forward like this, trying to see it a little bit better. Maybe you are a little lazy like me about taking your glasses on and off when you don't necessarily need them, and that contributes to those sorts of problems. And so that's one of the reasons that even though in some ways these repetitive stress issues are pretty simple, it can be kind of complicated to get to the root cause of those things. And that's why sometimes it makes sense to consult someone like me who specializes in those persistent pains that have perhaps developed over a period of years. A lot of folks are not aware that physical therapists have a doctoral degree that allows them to diagnose and treat a huge variety of different conditions. Almost anything that affects the musculoskeletal system or the nervous system and is causing pain is something that a physical therapist can help you with. And there are actually a lot of systems that you would never suspect physical therapists can help with, like the vestibular system, for example. Sometimes folks will get vertigo. You'll just wake up and everything will be kind of spinning. There are physical therapists who specialize in vestibular therapy. There are physical therapists who specialize in pelvic floor therapy for folks who have issues going to the potty. So there are lots of different things that physical therapists can help you with that you may not think initially to go to a physical therapist for, but if you are the sort of person who is looking for something that doesn't involve taking pills or waiting for a surgery if you must eventually, or going for a 6 to 12 week stint of 2 or 3 times a week physical therapy for it, when maybe you could just spend a little bit of extra time taking a look at your environment, figuring out where it is that you are bending yourself in ways and getting stuck, and then spend a little bit of time trying to reverse that. So for example, if the problem is that your wrist is bent this way all the time, one of the most commonly prescribed exercises is just to extend your arm, okay, like this. You lock out at the elbow. And if you've been holding your wrist like this all the time, that's probably why it hurts, okay? So bend and extend out at the elbow like this, because there are some muscles that go above this elbow joint. So you want to have that locked out too, to put those things on as much stretch as you can. And then you put your other hand in front of it, and you want to try to have as much even pressure as you can on this side, and then you just hold, okay, and stretch that out. And a lot of times that's all you need in order to reverse a pain that hasn't been there for very long, okay? The same goes for if you have your wrist set in a position so that it's bent like this at your keyboard or at your sewing machine in your garden, when you're doing just one particular activity that you end up doing a lot or having to hold for a long time. You can just go the other direction, okay, and stretch your wrist the other way, like this, okay? And in this case, you want to make sure that you've just got even pressure applied to the back of your hand like that. Stretch like in this position, and you hold that for 30 to 60 seconds. Now, do you hold it for 30 seconds or do you hold it for 60 seconds? That's one of those little details that varies a lot from person to person. Generally speaking, folks who are sort of at the younger end of the age spectrum can hold stretches for about 30 seconds. And as long as they're done on a regular basis, they will see a good result over time. Sometimes folks at the sort of further along side of the age spectrum will need to hold stretches for more like a minute in order to really feel some real lengthening happening there. But again, this stretch and this stretch are kind of worth their weight in gold when it comes to managing wrist pain, okay? Another thing that a lot of folks have trouble with is pain that affects the thumb or kind of down here at the base of the thumb. If you have that particular problem, you may need to just put more emphasis on stretching the thumb and keeping this part clear. And so that's one of the things that I spend a lot of time on in my office, is finding the exact exercise that will feel the best to a person and end up reversing whatever that pain issue is the most quickly, the most effectively. Sometimes it takes a couple of tries, but the great thing about physical therapy is that you are never really doing something that causes a fast, permanent change, okay? Everything in physical therapy, at least over here at Patient PT, is all about, you guessed it, patience and dedication, learning how your body really works and what it is that is really contributing to a specific ache or pain so that you can solve it for life. One of the things that I love to hear the most over here at Patient PT is folks who tell me that they assumed that they were going to have to deal with this or that ache or pain for the rest of their life because it was just a part of getting old, or because they heard it that one time and it's just never going to be the same. And those messages are very common in the medical world, and there are a lot of very widespread and understandable beliefs about age getting in your way and just causing these sorts of aches and pains um, to be inevitable and for you to be stuck with them. But from a physical therapy perspective, almost all aches and pains are totally preventable, totally fixable. Patient PT, I really pride myself on being more than just a physical therapy clinic. You are probably aware I have not just been a physical therapist for the last year or so. I've actually been a licensed massage therapist for, I believe this is my 16th year, 15th year as a massage therapist. You lose track after a little while. So I have been specializing in hands-on personalized care for a really long time, and there is nothing I love more than helping people get past those aches and pains that have been holding them back from doing the things that they love, or doing the things that they love as much as they used to. So if you're looking for some suggestions that are more specific to your situation on what to do and what not to do in order to prevent your pains over the long term and keep and maintain a pain-free lifestyle, come and see me at Patient PT. I have everything from massage therapy to elective Graston treatments to full physical therapy treatment plans. And as always, you don't need a referral or insurance because physical patient PT is a direct pay practice. So that means that there is no insurance company getting between you and your healthcare provider. And it is between us to decide what is going to work out the best for you and your lifestyle, and not somebody else's profit margin. Okay, so that's my Wellness Wednesday for today. I hope that it gave you some good pointers on how to deal with that upper body pain. Remember, bottom line is to reverse whatever it is that's causing that pain, okay? So if it's not your wrist that's hurting, maybe you need to get that head back a little further because you are holding it too stiff. Maybe you need to tuck these shoulders back a little bit more and focus on strengthening some of those shoulder stabilizing muscles, all right? But if you need more specific recommendations on how to reverse these long-term repetitive stress injuries, I'm always here over at Patient PT. You can see all of the information about my business and my pricing and everything at patientphysicaltherapy.com, and you can even submit a contact form to request an appointment. So I hope to hear from you soon. And if you have any questions about this Wellness Wednesday or anything else that I talk about in any of my other videos, I love answering questions, and I can't wait to hear from you. You can email me at patientphysicaltherapy@gmail.com or right here on Facebook via Messenger. I hope to talk to you soon.